Hi, I'm Denny Sakkas and I'm Chief Scientific Officer at Boston IVF.
I am Jaimin Shah. I'm the third-year clinical fellow at Beth Israel Hospital in Boston IVF.
So um, for many years now, Boston IVF, even though it's a private clinic, we actually have fellows that spend 3 years with us to actually do their reproductive endocrinology and infertility specialization. So these doctors are already obstetrics and gynecologists, and lucky enough for us, we have Jaimin that joined us several years ago and now is in his third year of fellowship. Many years ago, I had another fellow that worked with us, and we were interested in looking at how things have changed in IVF over many years. And one of the things we're really interested in, obviously, was to see have birth weights changed of the babies born over many years. So luckily, Boston IVF has been around a long time, and we published a study many years ago looking over a period of about 15 to 20 years, and actually showed that singleton births, which are important, just when a patient has one baby, the baby birth weights actually hadn't changed over time. So actually, we wanted to revisit the question, and Jaimin can explain why we wanted to revisit that also.
Yeah, so in the study that I had completed with Denny, we were trying to look at effective perinatal outcomes with autologous Singleton IVF cycles and how that might have been impacted over 24 years. It's important when you're doing IVF, trying to look at the impact it has on perinatal outcomes, because that has an impact on our clinical management and also management from an obstetrician standpoint. So this was a retrospective chart review over 24 years, and we were trying to specifically look at perinatal outcomes such as preterm birth, less than 37, less than 32 weeks, less than 28 weeks, looking at larger gestational age. And the reason why we wanted to relook at this is because over the years, we're always trying to find different things that we can do from an IVF standpoint, from the laboratory or clinical aspect of how we can improve clinical care and how this will impact outcomes for our patients, such as the perinatal outcomes. So what we had specifically seen is we had seen a trend in a decrease in preterm birth less than 32 weeks, and also a decrease in larger gestational age in our population over the entire cohort. And we also saw that the birth weight had slightly decreased every year by a couple of grams over the 24-year period. And the reason why we also wanted to look at this is there was an increase over the last 5 to 10 years of the utilization of frozen embryo transfers compared to fresh IVF cycles, and trying to see how some of those changes may have impacted. So those are some of the key findings that we had seen. And then the next question is, well, can we have an explanation as to why we might have seen some of those changes? Some of the changes we had tracked over the course of 24 years, we had seen some key laboratory changes, such as the way we freeze embryos from the slow freeze into the vitrification process. Also, the type of incubators we use, using a benchtop incubator, and also the type of culture media from a dual step to now a single step culture media. So basically, there's been certain laboratory changes that might have had an influence from our statistical analysis that might have played an influence. So it kind of shows that over the course of 24 years, some of the things that we have been doing in IVF laboratory and clinical management has been showing to have a positive improvement in certain perinatal outcomes, which has obviously a key importance for our patients and for the general OBGYNs treating our patients.
Yeah, I think it's an interesting paper. So over a long time, 24 years, it's interesting because, and it's important that we only looked at singleton pregnancies, because obviously I think IVF had a black eye from doing multiple embryo transfers and having a very serious impact on offspring by, having an increase in twin and triplet pregnancies, and unfortunately even more than triplet pregnancies. So I think it's important to use singletons as a parameter to follow the live births of when only a single child's born, but to show that our impact actually, and the evolution of the technologies that we're applying, which have also improved pregnancy rates overall, that they're actually not harming the offspring. And in effect, I think good for us. In effect, it shows that I think what the changes that we're implementing in improving success is actually also hopefully improving the outcomes of the offspring. One of the real interesting factors, and we weren't the first to show it, that it's a bit counterintuitive, but the frozen live birth weight versus fresh live birth weight. So when we transfer embryos on a fresh cycle versus a frozen embryo transfer cycle, the frozen embryo transfer babies are consistently slightly higher in birth weight than our fresh ones, and it's something we're really interested in. I don't know if you have any comment on that, Jaimin, for now.
No, you can continue.
It's just a fascinating thing to know. Like I said, counterintuitively, that you would think a frozen embryo transfer actually may be detrimental in some way, but it's actually really encouraging that, now with the impact this new freezing technology is having on vitrification, where we're actually residing to or reverting to doing frozen embryo transfers much more. Actually, those offspring from the frozen embryo transfers are closer, I think, to the natural conception babies in birth weight, whereas from fresh transfers, which is a bit strange, they're slightly lower. And I'm talking about, I think it was 150 grams around there, the birth weight difference. So one of the things that is interesting is that moving more to frozen embryo transfers may actually be also improving some of the outcomes, the perinatal outcomes that we're seeing also.
Yeah, interestingly, with as Denny was saying regarding the frozen embryo transfers and how that correlates to spontaneous conception. So looking at kind of correlations to the CDC national data, looking at like the preterm birth rates and also the birth weights in general are pretty consistent kind of in relation to the frozen embryo transfer cycles as compared to the fresh IVF cycles. The other thing to consider is prior papers have shown that in correlation with frozen embryo transfers, that there is an increase in large gestational age babies. And in our study, we were shown that actually has now been changing to now have a decrease in large gestational age babies with frozen embryo transfers. And that always has been a perinatal outcome that has kind of given frozen embryo transfers maybe a negative connotation, but in this sense, it's showing that more of a positive effect, which is a great thing for IVF clinicians and also for obstetricians.
So Jaimin's actually following up on this study. We're doing actually a more international study, which we're really excited about, looking at some of our collaborators in South America and Europe to actually see if the same trends have been shown in different countries also. So hopefully in a year or so, we'll be able to present the outcomes of that more international study. And even though our study was actually a very large study, I can't remember how many, I think we had well over 9,000 fresh and 5,000 frozen babies included in the study. So we'll be actually having many more in the international study. So Jaimin, I don't know if you have any concluding words of wisdom, given you're the MD in this discussion.
I think just to kind of highlight some of the main conclusions is that the things that we're doing from a clinical standpoint and from a laboratory standpoint for our IVF patients, we are showing positive changes in perinatal outcomes. And I think that's the most important thing, that we are always continuing to evolve and change and trying to find different ways that we can improve patient care. And then it's important to track these outcomes, because if you're going to make changes, you want to see how that is reflected in patient care, and specifically, more importantly, perinatal outcomes, because those are things that patients care about, and those are important things of how well that baby is going to do from certain outcomes. So to end is that we are making great strides, and I think this study kind of highlights some of those key changes that we're able to carefully document over the 24 years. So this is all positive things, and we're excited to see what that international study might show here in the coming months.
So thank you. Thanks for joining us today. And if you have any questions, you can always contact us at Boston IVF. Thank you. Bye.
Thanks.